Jessica, hi. Great post this week. I love the topic that you chose of competing medical issues when completing a substance use disorder assessment. It is interesting to read about this because my husband and I were just talking about this the other day. He is a drug and alcohol rehab counselor, and he was talking about how often he has a patient with co-occurring disorders. He said his LIP stresses the importance of addressing these, and actually the co-occurring disorder treatment plan is typically the first one that they build for that patient. Among the things he sees the most of it is PTSD, depression, and ADHD. After watching your video, I asked him which one seems to be a struggle the most with his patients, and he said without a doubt depression, which I found interesting as well. The good thing about working with depression is that many of the times it seems like there is something behind that depression that can be uncovered and talked about to assist in the healing process. There has been something that happened to that person that causes them to feel a deep shame, guilt, or hurt that they carry around with them, and talking about these emotions instead of repressing them, along with medications, are huge in assisting the patient with overcoming their depressive symptoms. I will tell you something else that is interesting. It seems like when the patients get a handle on their co-occurring disorder, that they can address their substance use easier and really focus on putting a better version of themselves back into the world. It seems like when the weight of the medical issue is taken care of, the addiction is easier to manage. It begs the question to me why this isn't a bigger focus in more facilities. Why isn't there a screening for these common medical conditions that is administered with the DSM-5 screening questionnaire when they're trying to establish if the patient has an alcohol use disorder? If I had to guess why, it's because the high operation tempo of a treatment facility and limited resources. I believe dealing with the addiction community is already so overwhelming, it is difficult for them to add more to it, and then things like this fall to the side. The funny thing is that it would actually make their job easier if they worked to include it. Anyways, great video, and I really enjoyed your topic. Thank you.